I am Dr. Jennifer Dimoff. I'm an assistant professor at the Telfer School of Management at the University of Ottawa. And my specific area of research is in organizational behavior and human resource management. And I do quite a bit of research on the interaction between managers' behaviors and organizational policies and the influence on employee mental health and well-being. And today I've been asked to kind of discuss some of the things that managers can do to safeguard employee mental health, to protect and support employee mental health, specifically in times of crisis. And a lot of what we're going to be talking about is important at any point, but it's especially critical right now. There has never been a more important time to protect employee mental health. Right now, protecting employee mental health is synonymous with protecting business objectives. It really is as simple as that. Right now, employees, just like many business owners, are dealing with a tremendous amount of uncertainty. Uncertainty about job security, uncertainty about personal finances, uncertainty about their own health, as well as the health of their loved ones. These things together combine to create a perfect storm for high levels of strain and high levels of burnout, which are both precursors to more serious mental health issues such as anxiety and depression. So it's very critical that managers prioritize not just getting the work done, but getting the work done in a way that is going to preserve employee well-being and psychological health. And this may be even more true for employees with more complex living situations. So employees who have partners or spouses or other people in their home who are working in healthcare, or employees who have children or elder care responsibilities, where the entire social structure has changed. Daycares have closed, schools have closed, retirement homes and long-term care facilities are closing their doors to visitors. This is very much changing our social climate, and that affects people's mental health. Social distancing can affect employees' mental health if managers aren't able to do a good job in supporting not just the worker, but the person. So managers can do this in a couple of different ways. And I'm going to talk about a few different ways. This is not comprehensive. It's just a few things that managers can do right now to help safeguard their employee mental health. So the first starts, and everything begins and ends with communication. So we call this in the research world informational support. And this is where managers can really provide as much information as possible in terms of how employees can protect themselves from the virus or other issues that might be arising. So they can protect themselves from a health and safety perspective, basically, how to practice good self-protection and hygiene behaviors. So washing hands, if you're in healthcare, wearing a mask, how to maintain or preserve the safety capabilities of that mask, for instance. But it's not just about giving the employee information about this is how you can protect yourself. It's also information about how the organization is taking efforts to protect employees. And that's going to differ from organization to organization and from industry to industry. And that's okay to employees. Basically, the content of the communication, the content of that information is going to change. It's going to be dynamic. It might change from day to day, but it's important that managers be in touch with employees. Because when there isn't that contact, when there isn't that information, employees can create their own narratives. And sometimes, especially in times of uncertainty, those narratives are negative. So it very quickly, people start to create their own reasons for why the organization isn't communicating. Is it because the organization is under financial strain and they're not going to survive? Is it that they're not communicating because they don't know and they don't care? Is it that they're not communicating because the employees are not a priority. You don't want those narratives being developed. So communicating as much as you can, as readily as you can, and in mediums that employees are actually going to read, or through video conference or things like that. So basically communicate the information and communicate it in a way that employees are going to be able to digest. And part of this communication as well is about communicating trust. Trust that employees are capable of dealing with this situation. Trust that the organization is going to be supportive in helping them cope with these uncertainties. And it comes full circle that the more that you impart your trust in employees, the more they're going to trust you. So the second piece of all of this, so we've talked about informational support. The second piece is something we call instrumental support. So basically providing tools and resources so that employees can get the job done in whatever world that looks like. So whether that's providing software, so access to Zoom, making sure that video calling is a possibility, making sure that there are internet connectivity issues are not going to be a problem, that employees have VPN access. So those types of technological tools are really important in times like this. It's also really important that people have physical tools for whatever that is. So we were recently speaking with a call center group, and they realized that in part of transitioning everybody to be working from home, and that was what they're doing to protect their employees' physical health, that they need landlines to be able to supply their employees, or the employees need landlines in order to do their jobs. That's not something a lot of their employees have. This is a younger demographic, most typically working in the call center. They only have cell phones. So this was a big marshaling of resources from this organization to get every employee equipped with a landline and make sure that their house is landline connected or their apartment is landline connected. So giving employees those resources so that they can keep working, even though their work setting is going to look a little bit different. So it's also important as part of this for managers to ask employees, what tools do you need? What resources do you need? And then it's on the employees to give you that information, because employees are the experts. They know what they need to do their job. You as the manager, it's your job to make sure they have those things. Because we are working in this very uncertain time, jobs are changing. And what might have been standard operating procedure yesterday is no longer the case today. So if employees can be, we call it job crafting. So it's basically changing tasks and responsibilities and duties, very much driven by the employee. So if an employee's role has to change, involving them in what that role is going to look like, what their new tasks are going to be, making sure that they have the support to be able to do those things in whatever this new environment is. So for instance, right now there are a lot of restaurants who are trying to transition their servers and their wait staff to takeout type of staff and even delivery drivers. So making sure that they have driver's license, making sure they have an operating vehicle, making sure that they're going to be able to do those new roles safely and still get a paycheck, which is really important to our psychological health and well-being. So in alignment with that too, is it's not just about providing information and tools. Managers are also in a great position to protect employee mental health by providing emotional support. And this doesn't mean counseling or anything like that, but it means checking in with employees, asking them how they're doing, being empathetic, being understanding that this is not typical, that we are all learning, we're all figuring this out, and it's okay for there to be some stumbles along the way. So being kind, really showing that compassion and flexibility and patience with people. This is times we've never experienced before. And it's okay to say that as a manager, to say, look, I'm learning too. I'm figuring this out. This isn't going to be perfect. We're going to do our best, and our best is going to be good enough. And by doing that, managers are acting as role models. So that's what you can do as a manager, is act as a role model. So protecting your own mental health, whatever that means for you. So prioritizing your own health, your own well-being, your own work-life balance right now. So if that means that you're in a non-essential role and you can stay home, stay home. If you have to be going into the office or the work site, wear protective gear. So it's not just about asking your employees to do these things, it's about you doing those things too. Today, my husband and I were talking about some of the stressors that we're both facing and working from home with a child in the house, a young child in the house. And he made the analogy to using a mask on an airplane, that if you're in an airplane and the oxygen masks come down, you have to put the oxygen mask on yourself first before helping another person. And as a manager, you need to protect yourself first so you can protect your employees. And doing all of these things is not just going to make you an effective leader right now in the middle of a crisis. It's going to make you an effective leader long term. And that's going to reap benefits when things start to return to a level of normalcy, because employees are going to feel valued, they're going to feel cared about, they're going to feel that their health and well-being has been prioritized by you. And all of those things are going to translate into higher levels of trust, higher levels of job engagement and satisfaction, the likelihood of continuing and staying with the organization, so high levels of commitment, which of course all translate into higher performing teams, groups, and organizations that are going to not only be able to survive, but thrive.